Welcome to Aesthetic TV. I'm Dr. Andrew Orden, and I'm here with my co-host, Stuart Brazel, today to discuss the latest trends in non-surgical body shaping.
Thanks so much for having me, Dr. Orden. So we've assembled a distinguished panel of experts to get us up to speed on all the latest and greatest in this popular and rapidly growing category in aesthetic medicine. So please welcome Dr. Tal Humes. She's the founder and medical director of Denver-based Vital Medical Aesthetics. Welcome.
Thank you. Nice to be here.
She is noted for her expertise in cosmetic and laser-based medicine and is well known for her cutting-edge laser treatments and advanced injection techniques. In addition, she trains physicians throughout the U.S. on lasers as well as Botox and dermal filler injection techniques. Impressive stuff. We also have Dr. Daniel Mann, a board-certified plastic and reconstructive surgeon. His private practice is in Boca Raton, Florida. Welcome.
Thank you.
Welcome.
A well-known author, artist, inventor, and educator, Dr. Mann is noted for his work in skin rejuvenation, cosmetic laser surgery, liposuction, and facelifts, and is a frequent guest lecturer at the medical conventions. Got a great panel.
Well, he pretty much does it all, right?
Yeah, so thanks so much for being here today.
Thank you.
So to get us started, let's get an overview. Dr. Orden, can you give our viewers a primer on non-surgical or non-invasive body shaping?
I'd be glad to, absolutely, Stuart. You know, when we talk about non-invasive or non-surgical body shaping, what we're really talking about are procedures that utilize various forms of energy to remove fat instead of more invasive surgery.
Okay, so that means no cutting and no blood, is that right?
Exactly. It's amazing what you can do with these devices. Also, they each use a different approach. They all use heat generating energy or cold to break down fat cells within the body, and then your natural metabolism removes them on its own. There are four basic types of technology that we use. These are radio frequency or RF, ultrasound, laser, and finally freezing.
Well, this all sounds very interesting, so let's get into each type of device and explain how they work for our audience. So Dr. Mann, I'll start with you. Can you talk a little bit about radio frequency devices?
As a board-certified plastic surgeon who is busy with plastic surgery, I'm very interested in helping patients with radiofrequency. Radiofrequency is very important, has been for years, but now with using bipolar devices, multi-frequency device, all in one handle, we can offer patients improvement to the skin in many parts of the body, face, neck, chest, body, and that's an amazing device.
Dr. Mann and I, we're operators. We like to cut. We prefer to do the surgery, but for a number of reasons, surgery isn't always the #1 choice for them. Either they're not ready for a more invasive, let's say a full body lift or a full facelift, so radio frequency tightening would be a good option, or somebody just doesn't want to go under the knife for whatever reason, they're afraid, or other health issues.
Absolutely, it can be scary.
So it gives us something that we can offer to non-surgical patients.
So this is a great option. I'm sure our viewers would like to know what you all think about these technologies. What are the advantages and disadvantages of each? Dr. Humes?
Well, depending on what you're looking at, I really do like a lot of the different technology. But for me, what I'm using mostly is radio frequency. What I like about it is that it does cause programmed cell death or apoptosis, and it's getting deep into that fat layer like we were talking about before.
Dr. Mann?
Yeah, since you mentioned reaction, I like this device because what I find out that in the single handle, you can do multi-channel, multi-frequency areas of the bodies. And it depends if it's a thick skin or thin skin or old or young. You can go with different kind of modalities and get deeper or more superficial.
And then any disadvantages?
With that, not really. You know, there's really no downtime. It doesn't hurt that much, and you don't need any pain management.
So these are all quick procedures, in and out, great results?
In and out, 30 to 60 minutes, depending on how big the area is, and we're seeing great results.
Very little recovery. You go back to exercising much quicker than if we were doing a body contouring surgical case. So those are some of the advantages. You know, it's been out for years now, but they keep improving the technology all the time, and I have to admit, I've had a little bit myself. And it works. It's for women, for men as well, and younger, older. It really is a great alternative for most patients.
Especially if they have vacuum also in it, so the tissue gets closer to the device and you can go deeper or more superficial. Very comfortable.
That makes perfect sense. And Dr. Mann, I understand though that you believe in this treatment so much you actually did it yourself?
Right, exactly right. The staff did it for me, and if it's good for me, it's good for patients. And you could see this was done like this, slowly over the jawline, and it decreases the jowl, and it gets a better definition to the neck. If you look at the pictures, you can really see that the jawline is much more defined, the neck is tighter, the jowls are less, and the overall appearance is superior compared to doing nothing.
Well, clearly it's worked for you. He looks pretty good.
I was going to say, you look fantastic.
Thank you.
Good for you. Natural look and no downtime.
How's that sound?
That sounds pretty good
That's
to
what
me.
we're striving for.
I bet. Well, next up, we'll be demonstrating examples of these technologies with real patients. So stay tuned. We'll be right back. Here we are in the Aesthetic TV treatment area, and I've got Dr. Daniel Mann along with our patient Crystal, and we're going to be demonstrating the reaction from Viora. So Crystal is with us today for treatment of some cellulite around the abdomen. Now, Dr. Mann, walk us through what we're going to be doing today.
This reaction machine is very versatile. See, with one handle, you could vary the degrees of the improvement by different frequencies. You could do 1 or 2 or 3 frequencies, and you can improve area of the belly. For instance, if there's loose skin, you can then tighten up. You can prevent cellulite from getting worse. You can even treat areas like the inner thighs and the arms. We do have different handles for it.
For all parts of the body. That's great.
That's correct. For instance, you could do areas of the face and the neck, especially in areas of the neck. You know, this is so important because I had a treatment myself, and there was a lot of improvement. So if it's good for me, it's good for patients too.
Everybody wants that nice, firm neck.
Right, and you can improve the neck area. The ability to do multi-frequencies plus the vacuum, it gives you ability to improve many areas of the face and the neck and the jowls in a very delicate way, preventively, so they look much better. Several treatments and they'll become better and better. Everybody wants to look better.
Well, the reaction from Viora seems like a really easy treatment, very fast. You could come in and do it on your lunch hour.
That definitely.
Well, thank you so much, Dr. Mann. Thank you.
We'll be right back, everybody.
Well, this has been a great introduction to the world of non-invasive body shaping and the different technologies that are used. I think our viewers will get a lot out of our discussion here today.
Oh, absolutely, Doctor. I know they will. And I want to thank our guests, Dr. Daniel Mann and Dr. Tal Humes, for being with us and helping to explain the subject so well.
Thank you so much.
Thank you.
Thank you for having me.
Good stuff. And to our viewers at home, thanks again for joining us on Aesthetic TV. Remember to stay tuned
and stay beautiful.